2006 tot 2017. Maar voor mij is het nog steeds makkelijker om deze presentatie in het Engels te doen. Maar dat betekent wel dat jullie rustig kunnen vragen stellen in de chat in het Nederlands. Dat komt helemaal goed. Goed, ja, ik woon nu dus in Denemarken. So I'm sharing here the museum called Aros in Aarhus, where we live now. I usually say I live now at the end of the rainbow. If any of you are ever coming to Denmark, let me know. And I really recommend to go to the rooftop here and have a stroll in the rainbow. It's designed by an Icelandic artist. And it's really the highlight of our city here. I do miss Netherlands a lot with all our friends after 10 years, but I also come back regularly, lucky enough. But my journey into the health literacy field started at Maastricht University. And I'm now working, as you can see here, with some examples of different organizations. I have a background in public health science. Before that, I studied medicine, but switched. So I never graduated as a medical doctor, but I did study public health science at Copenhagen University. I got very much engaged in global health matters and policy matters. And eventually my career took me to Maastricht University, where I specialized in health literacy, and this is what I do until today. And you're very welcome to connect on LinkedIn, and there is also now a newsletter called Health Literacy Matters, which you can sign to or subscribe to, and follow me and my activities. But let me go back to the beginning here. Recently, I attended a family reunion, and you can see here my great-grandmother and father. They were teachers in a very small community in the north of Denmark, and we visited the cemetery, and you can see here the gravestone, and it actually says Christine Sørensen, and she passed away in 1977, and I can remember her vaguely. But I have heard many stories about how they were trying to develop that rural area and enhance the potential of people. And jumping then to our time, this is what I try to do still also. This is a photo from Maastricht University, where I was teaching at a summer school this summer, and with a lot of international students coming to the Netherlands to study. And what I always find very fascinating doing summer schools and teaching across the world is that I meet students from all walks of lives, and it really is a matter about promoting health and well-being of people where they live, love, dream, work, vote, and play. But we also realize in a global world that it's very often also about just trying to survive. You know, the health is not on the top of the mind because there are so many other struggles, maybe related to poverty, war, disasters, family issues, work issues, and so forth. So while we try to shape a dream world, people are really facing a lot of other matters, and what we think about health may not be what they think about health, and we'll discuss this. So the question is, what is health literacy and why is it important? And for me, it's important to recognize that we develop health literacy during the life course. So from when we are even not born, our parents, during pregnancy, it's influenced by different factors as babies and infants, during school, alive as teenagers, growing up into adulthood, and later when we talk about healthy aging. And the characteristics of health literacy keeps changing. You know, when we're children, it's about brushing your teeth, wearing a bicycle helmet, the zwemlessen. That's what I can recall from my time in Netherlands. And later on, it's probably about the risk factors, sexual education, drinking patterns, and then adulthood is about having a work-life balance, no stress, and healthy aging is like keep moving and so forth. So the health context keeps changing. I always get the question also, what's the difference between health education and health literacy? And especially when we are talking with people where English is not our native language, like for myself, I speak Danish and Dutch and so forth. Professor Dan Nadbeam from Sydney University usually say that health education, it's a process of learning experiences to pursue knowledge, motivation, and skills. And these learning experiences can be formal education, what we learn in school, but it could also be non-formal education that we get by joining like football clubs or scouting or so forth, and informal learning experience is what we get at home, in family, and the wider society. So it's these mix of learning experiences, that's our health education. And eventually the outcome of this is our health literacy. That's one way to explain it. So this is really our ability to act, not only knowledge, Kenny's, but also ability to actually act. And we know from research that health literacy helps saving time, costs, and lives. And it helps avoid people getting lost in healthcare systems. We know that health literacy helps to build more inclusive society, and that it respects that no one size fits all. And it helps to build trust in health systems. It also enhances personal attitudes, knowledge, and competencies. And we know from research that it's not only about physical health and social health and mental health, but it's also about emotional health, spiritual health, sexual health, financial, digital, and so forth. Health has so many aspects. But when we do research, we sometimes tend to forget that we only focus, for example, on physical, mental, and social health, but all the other factors matters too. And I think this is where from a global perspective, we still have a challenge to recognize all these different facets of health. And I would love to hear from you how you are including these aspects in the work that you are doing. And when we talk about health, there are also so many different domains. We may have a tendency to only focus on health care, but there are many other domains here, from health protection, where it's really about protecting lives. So, for example, in disasters, it can be the cure and care in hospitals and in primary care. We are talking about disease prevention and health promotion, which happens in other sectors. We are talking about self-care, which is very much the personal aspect of taking care of your health, managing health, and the broader well-being, where it's about well-being of people and even the planet now. So again, I'm encouraging you to think about health in a really broad perspective, while at the same time also being able to zoom in on specific aspects that is where you are, perhaps working. And then the other side of the equation, literacy. What do we mean with that? And then when you look into a dictionary or lexicon, you can see that it spans from being aware of something, or being knowledgeable, being competent, being proficient, and being an expert. And I think our task when we talk about health literacy is really to move people to grow their potential, as I said in the beginning, to move from the awareness to really being competent in dealing with their health and well-being. And we know from some patients where they deal with health every day, 24/7, 365 days a year, that they are experts, much more than maybe a lot of other stakeholders when it comes to their own personal health. As many of you know, my journey started really with the European Health Literacy Project, which was a European project hosted by Maastricht University and with partners in 8 countries, thereby also Netherlands. And in Netherlands, it was the RIVM that was our partner. And with this group of 8 partners in 8 countries, we made a literature review of what is health literacy. And we found different definitions that were very much overlapping, but had all of them some specific nuances. And we developed this all-inclusive definition where we say that health literacy is linked to literacy and concerns the knowledge, motivation, and competencies to access, understand, appraise, and apply information in everyday life, to form judgment and make decisions regarding healthcare, prevention, and health promotion, to maintain and promote quality of life during the life course. You can see this is really a research definition, but it helped us a lot to fully understand and grasp all the different facets of health literacy. And first of all, in the first line, you can see that we distinguish health literacy from literacy. We also specify that it's more than knowledge. It's about also motivation and competencies to act. And when acting, it's about finding, understanding, appraising, and applying information, not only when you're ill and in a healthcare setting, but in everyday life. And that was my starting slides, where you play, love, vote, cook, and work, and so forth. And it's about forming judgment. So there is no one size answer for everyone. Everyone has an active part in taking decisions or assessing what is good for me and for my family or for my community. And again, highlighting it's not only about healthcare in the clinical setting, but it's also when we talk about prevention in a wider matter and health promotion when we are actually trying to stay healthy. And not even ill yet, perhaps. And then health literacy and health is not an end in itself. What is the end for us is really quality of life, about being flourish, about developing the full potential. And then this happens during the life course. So there are so many facets. Every word means something in this definition, and this is why we used it for our research. And we also developed a conceptual model, which helped us identify the factors that are influencing health literacy, and that's the personal factors. So this could be education, age, faith, ethnicity, and so forth. Situational determinants, so where you live, where you study, for example, whether you grew up in a small village or in a big city or in a certain community. And then the wider social and environmental determinants. So, for example, growing up in the Netherlands or growing up in Denmark, that's a difference. It could be a geographical difference. And then we saw from the research that was informing this model that health literacy is closely related to service costs, health service costs, and also health behavior and how people engage in healthcare and prevention, health promotion. And it has a really strong relation to inequity and equity, and eventually also people's sustainability. So also to say it's not only about health matters, this is also relevant for social and economic matters. We always were inspired by Nudbeam. We didn't use his model, but it informed the other model, saying that when people are finding information, it is about functional health literacy, knowing the basics of how does a body work, what is the healthcare system, how does that work, and being able to engage is inspired by his interactive health literacy, and to assess and act, that is very much the critical health literacy in his approach. And eventually, by doing all this, we are aiming to get more health literate people and societies. So for us, it's important to highlight that health literacy is content and context specific. So for each area of work, you will need different skills, different sort of knowledge. So if it's about diabetes, this is then diabetes literacy. If it's about cancer, we're talking about cancer literacy. If we're talking about school health, then it's school health literacy, and so forth. So it kind of changes its nuances. I call it here, health literacy is like a chameleon reflecting the color of the environment. So we're talking about the same creature, we're talking about the same animal here, but it does take color after which domain, which an area, which focus that we have, and for which target group. And I'm sure you can give many examples of this depending on what you work in which field you work in. I love this little cartoon from Australia. It really very clearly in a very simple way saying what health literacy is about: your health, being able to manage healthcare information, judging what is relevant, take a decision, and then speak with healthcare professionals and do shared decision making, and then eventually taking action and hopefully improve your own health. In their campaign from the Australian Commission on Safety and Quality of Healthcare, they always highlight that it has two components. We have the environmental component and the personal component in the center here. In US, we are leaning on Pagan Ratson's relational approach that shows that health literacy is very much mediated by people's skills and the system's complexity. And that means that it's this relational approach, and we can't look at one of the sides without the other. You will see that in the international discourse, in the international discussions, a lot of focus in the beginning especially was on the personal aspects of health literacy. But later, and I will come back to this, we have seen much more awareness now on the impact of how we design the systems, how we design organizations. So this is what health literacy is, but what are the challenges? So we started the first European health literacy survey in 2011, and in 2019 do the next one as part of the World Health Organization action network called Measuring Population and Organizational Health Literacy with 17 different countries. And you can see here that, again, about half of the people joining these surveys are facing difficulties, calling, problematic health literacy or even inadequate health literacy. We're using the same measurement tool in an adapted version. It's been refined so that it fits the purpose of many more countries. So we keep saying that limited health literacy is a public health challenge, even a neglected public health challenge, because in many countries it's still new. And also it's important because it's unevenly distributed. It's like champagne. Some people say champagne is unevenly distributed. We see that those that are at risk of being poor, having poor health and poor education, they are also very much prone to having poor health literacy. And some of the risk factors are low socioeconomic status, low education, coming from minority groups, being super users of health service systems, and having poor self-reported health. And it's not only a personal challenge, it's also big business, because if we add all this up, it means that 10 to 20% of health budgets are attributed to limited health literacy. This is from the UK. And US, they say that about 1 million unnecessary healthcare visits and adding a $1 billion. This is just from one healthcare provider group called the United Health Group. This is what they estimate that could be changed to make a much better fit between people's needs and the services that we provide. So this is why I call it that are saying that health literacy is a big business, but it does impact human lives. We see that those are affected. They don't have the same access to healthcare services. They very often are prone to lack of clear communication. We call it a silent epidemic because we're not really aware of who is affected. They go under the radar. And they are impacted on their sustainability and integrity because of not being able to get the same benefits, basically, as everybody else who can navigate systems, who can interact with healthcare professionals. So it's time to bridge the health literacy gap, and I know many of you are busy doing this. To me, I've learned in my work here at international level and with many different policy stakeholders that health literacy is a political choice. It's a political choice at local local level, in municipalities, in regions, for governments, for intergovernmental organizations like WHO, OECD, Council of Europe, and it is a priority. It's a choice. It's a deliberate choice whether we want to invest in people's knowledge, in people's competencies, and stimulate their motivation to support public health perspectives. And we have seen from an analysis of the Sustainable Development Goals that health literacy is an accelerator of most of the 17 goals, directly or indirectly. And this is why it's getting so much traction in recent years. It helps safeguard not only people's health, but also the health of the planet. And I like to share this donut model. It's from Professor Rayworth from the US. She used this donut model as part of climate change and environmental health. But the inner circle shows us the basic needs that we have and that we should try to accomplish. So food, water, income, health, gender, social equity, energy, jobs, and so on, resilience. So these are the basic needs. But the outer circle of the donut, that's the overspending. And we know from the climate change, these discussions that we're currently overspending resources. But we see the same in the health field, that in some situations we spend too little. We are not meeting the basic needs and requirements and obligations of people. And in other areas, we probably spend too much. We spend many resources on campaigns for people that already know, for example, or we have maybe systems that require checkups every 6 months without actually having the need for these checkups. If people knew better, they would be able to react on certain issues. We are doing a lot by automatism that actually costs us a lot of money instead of being based on health literacy and expertise. So there are many things we can adjust, and this is why I find this donut model very helpful. So what can we do? We need to adapt to people's needs. In many systems across the world, we see a one-size-fits-all approach where we give everyone a bicycle, like in this one, in the top line. If they need to learn to bike, we give them a bicycle, and we think we have helped them. But in fact, we have not. I mean, one can't even jump on the bike. Another one, it's too small, it fits, or it's too big. So where we need to go when we design our health services and programs and campaigns and so forth is to make sure that we facilitate information services in ways that fits the needs. So like even disabled people here get a bike, fits a bike, that we tailor it to their specific needs. And I think we still have a lot to do. The Dutch health system, as I know it, is quite good, but still we can do better. We also have a model from the US called the Health Literate Organizations, and our colleagues there, where we know that the American system is very different from European systems. It's all about, insurance-based, and you have to pay for your services. And this is where it's very important that we inform well, that we involve patients, that the management is clear on what kind of strategies can be used to increase patient involvement, make sure that it's transparent what services cost. And in Europe, we've been really inspired by this kind of work, but we also need at the same time to adapt it to our systems. And just for example, Denmark, Netherlands. In Denmark, we have a tax-based systems. I rarely see a bill because it's paid through our taxes. And in Netherlands, when I lived there, I would get a bill from the health, social health insurance, and sometimes also from health systems. So every country has to look at these models and see what fits the best. We cannot just copy and paste. And what is also important is to take a system approach to health literacy, so that we, on one hand, yes, invest in health literate organizations, but we also need to invest in the workforce, make sure that there are partnerships between different stakeholders. It could be public and private stakeholders, it can be patient organizations, NGOs, local authorities and national authorities. Make sure that we invest in technology that is appropriate, and dedicate the necessary funding, that we educate health literacy leaders and champions, and have keep having the human focus. So just to say that for me, health literate organizations are not enough. They are part of a bigger and health ecosystem, and this is what I mean with taking the systems approach to what we're doing. We don't do this in isolation. We are always part of bigger systems, also beyond the healthcare system. And some countries have started to recognize this. You will see that this one is the National Action Plan for Scotland. This is already the second version. The first one was called Making It Easy, and their second version is called Making It Easier. There are other countries that is following in these footsteps. So we have Norway, they have adopted a health literacy strategy. Portugal is also on their second version already. Some countries have included health literacy as part of more specific legal instruments, or it could be a cancer plan or diabetes plan. But only, I would say, a handful, or maybe 5 to 10 countries have really integrated health literacy as a policy mandate. And I know that the government in Netherlands have started to look at policy actions, and hopefully will join the European survey in the next round, so that you can get the evidence that can inform policy work. And in other organizations, for example, Council of Europe in Strasbourg, it's different from the European Union, because it has about 45 member states. So it's much wider than the European Union. Is more similar to the World Health Organization and the UN system. But it was developed after Second World War, and really focusing on democracy and human rights. And with them, I've been privileged to support their work. They take a human rights approach to health literacy. And we've launched a new guide to health literacy, which you can find on the website, which is called Access or a Guide to Health Literacy, Contributing to Trust Building and Equitable Access to Healthcare. And here we share lots of examples on how different countries work on health literacy. And what we see is really important, that those countries that have monitored health literacy at a population level and local levels, they act much faster than other countries. So I can really encourage to use measurement as a supporting argument for creating actions on health literacy. We also encourage to start early, and some of you may be involved already in health promoting schools and communities, and you can find this document, which we did from a global organization. I did this with our colleague in Germany, Okan Okan, where we developed this policy brief on creating health literacy for children and adolescents in school settings. And a big component of that is also investing in digital health literacy. And for us involved in health literacy, it might be a simple advice, but for politicians, it's not so straightforward, and especially not if you are in countries where the digital system is not as advanced, and the digital health system is not very advanced. So last week I was invited to speak to health ministers attending this symposium organized by the World Health Organization and the government in Portugal, which discussed the future of health systems in a digital era. And I was invited to a specific meeting for health ministers and addressed digital health literacy. And it's very interesting to see. For some, it's very clear. This is, straightforward. For others, it's very complex matters, and they're still trying to get their heads around it. Again, Netherlands is one of the front runners. We know that, but we also still have to recognize that there are people who are still not digital natives. They struggle to get online, maybe because of economic reasons, maybe because of technical reasons, maybe because of accessibility. And this is where we need to build capacity in the healthcare, increase health literacy as part of curriculum for health professionals, but also at the workplace. And it's been really interesting for me to follow how health literacy is now becoming a corporate health issue. So health at work and being integrated into health at work agendas, occupational health, and social corporate social responsibility. We've joined surveys with Economist Impact to check how these companies are developing around the world. And for me, interestingly enough, before the summer holiday, MSD is a pharmaceutical company, and Deloitte, a financial advisor company, they joined hands together with health literacy actors in Belgium and hosted the first Belgium national conference. So we see new stakeholders. It used to be more healthcare stakeholders, literacy stakeholders, but now many more different actors are joining. And it's all about helping people to navigate these complex systems that we build up. And this is why it's also very important to enhance the workforce skills. So this is an example where we work with European Oncology Nursing Society, but also patients and consumers and citizens and community leaders, so that we make sure that when we talk about health, we talk about people-centered health. So as I'm trying to explain, the evidence is growing, and we have collected a lot of examples in this International Handbook of Health Literacy, which you can download for free. And you will see there that health literacy is really a global movement on the rise. Here is a snapshot I did this morning from PubMed. Last year, 2,565 publications were published, and we're now on 1,800 already for 2023. And when I started my health literacy journey, I could basically print out all the health literacy articles and put into folders on the shelf, and that's not possible anymore. And with the awareness, we also see that there is an expansion of the policy mandate, not only at national level, but also international level. And it's really been a key issue now for the World Health Organization to promote health literacy. You will probably know the Solid Facts publication that was published in 2013. Recently, our colleagues working in the area of non-communicable diseases published a series of material together with the World Health Organization headquarters in Geneva. And the last one is on health initiatives in primary care, where we work with colleagues to integrate health literacy as a common denominator for all these different initiatives. So just to say, more and more examples are being published, and it's developed by experts in health literacy together with other experts in other areas. And it's just really fascinating to see how it's being year by year adopted by different sort of organizations. So I see a very strong commitment to change and also mobilization. And the alliance here, Alliantie Gezondheidsvaardigheden, is one of the first organizations or networks, and there are many more. Portuguese Health Literacy Society is quite new. We have the International Health Literacy Association, which we started in 2017. We will have our next Global Health Literacy Summit in Europe next year, probably in Zurich. We have the Asian Health Literacy Association that has been around for more than 10 years, and their next conference is in Vietnam, 2024. So if you're keen to travel, I can really encourage you to join. There are also some American conferences, both in the spring and in autumn. And this is where we really can meet the hardcore health literacy community, very much like we see here in Alliantie Gezondheidsvaardigheden. I had the honor to open the African Health Literacy Network Pan-African Conference a couple of weeks ago. So they are very much at the beginning, but they managed to unite more than 100 participants in their first conference. So we know that the awareness and interest is growing in Africa, and very much supported by other regions. But there is a unique network now taking on, speaking about the health literacy in the African context. And for me, it was always about empowerment. It's about learning people to speak up, but also professionals to speak up. When we see any inconsistencies, when we see any injustice, it's up to us to support people and patients and citizens to get the health that they need. Because if we don't solve the issue at the first time, it will start to evolve and be a negative spiral, and then it will end up costing a lot of more, many more resources, both at a personal level and societal level. And we live in a complex world. We know that we are faced with turbulence, I said, uncertainty and complexity. But despite that, I think the future is health literate. And why do I think this? It's because we shape it. We are the ones that shape the future. We are the ones that can pave the way. The future is not something that just happens to us. It happens because there are people that are taking action. And we know it can be done. We saw the big turnaround that happened during the pandemic. We saw that we had to learn about a new disease. We had to set up completely new systems, vaccinations, test facilities, and so on. And it happened within a few years. And there was developed a vaccine. So all the lessons learned, we can now apply to the health literacy field. And I encourage you to take the lead. You can do this by joining the different networks, also the global network of International Health Literacy Association, because if you do so, you are with friends, you're with like-minded people, and by working together, we can walk much faster and much further. Not only enabling, empowering people, but also shaping conducive, supporting environments. So for me, you are the true health literacy champions. You are the ones we lean on. You are the ones I refer to when I am invited to do all kind of different speeches for different stakeholders in policy, in research, in education. And I'm so happy and thrilled that you face this challenge with me, and you are the change that I can see. So thank you very much. I will hand over to you now, Ulrike and Eline, again for our Q&A session. Thank you.
Thank you very much, Christine, for sharing your insights. So we have more than 15 minutes for some questions. We will look at the chats first. We have some questions in the chat, Christine. Would you like me to read the first question to you?
Yeah, maybe, yeah.
Yes.